Although a recent journal from the National Institutes of Health shows that Black women in the U.S. have experienced major improvements with their health during the last century, the agency also adds there's still health disparities when it comes to Black women. Now, I want you to stop and process this information. The NIH says African American women are dying at higher rates than their peers and have shorter life expectancies. The agency also finds that Black women die at higher rates during pregnancy or within a year after their pregnancy ends. And when it comes to breast cancer, take a listen to this, a disturbing detail. Take a look at these numbers. The CDC says Black and white women are diagnosed with breast cancer at the very same rate, but Black women are 42% more likely to die from the disease. Of course, health experts point to a lack of access to health care and differences within the healthcare system as part of this problem. Now, here to discuss where things stand right now is breast cancer survivor Brenda August. She's joining us from West Palm Beach, Florida, and also with us is Nancy Brinker. She's a co-founder of the Florida Promise Fund, the nonprofit that helped Brenda. Welcome, ladies, to the Midday Jolt. We appreciate having you here.
Thank you.
Yes, Brenda, let's start off with you. First off, you were diagnosed with breast cancer back in 2020. Tell us about that process and how are you doing today?
Well, in 2020, I found a lump in my breast and I wasn't looking for it. It just, I was basically about to take a shower and I just ran my hand across the front of my breast and I felt this lump and, was taken aback by it, didn't expect that. And right away, I knew, I said, something is not right. And there were all sorts of things going through my mind because just about 2 or 3 years prior, I had retired from my job in 2016. So I didn't have any kind of insurance. I couldn't afford the insurance when I left my workplace. So I was living 3 years without insurance, medical insurance. And the first thing that came to my mind was, okay, if this is, Lord forbid, cancer, how am I going to be able to see a doctor? How am I going to be able to get my necessary screening that I needed? And I hadn't had a screening for about 3 years anyway. So right away, I called a friend and they were able to direct me to Promise Fund of Florida through one of the clinics there, Fund Care, and I was able to go and get the necessary treatments that I needed.
Wow. Well, what a scary journey, especially like you just said, you were retiring and had to go through that, but luckily you were in good hands. That's where Nancy, the co-founder of the Florida Promise Fund, comes in. Nancy, how was that connection with Brenda? And what kind of inspired you to help people going through this transition?
Well, I am also the founder of Susan G. Komen, which I founded over 40 years ago. And when I moved back to Florida permanently to live here, began to notice that we had, looking at the data, which I often do, we have 85,000 women in Palm Beach County who have no medical home, no health care, and nowhere to go, and no insurance, no Medicaid, nothing. And so this right away rang a bell, and I just said, this can't happen. So 4 years ago, we created the Promise Fund of Florida, and our goal was to partner with the federally qualified healthcare center system, which is a tremendous system, which Brenda just said that she had gone through with cervical issues. And they do provide care. And we were able to get a mammography installation from Hologic into the federally qualified center of health called Found Care and develop a real women's breast screening clinic. And then we also do cervical checks as well and other services that women need. One of the greatest problems we have, however, is that Black women do die more often, and it's disproportionate, and we don't understand some of it. A lot of it is related to being lower income, not having access to care, not getting access, and then just seriously not knowing that they need a screening every few years or every year. So it's a real conundrum. And I am committed, as are all of us at the Promise Fund, to make sure that this is not going to happen in our state moving forward, that we are going to have much better rates and much better opportunities for women to live full and healthy lives. I will tell you, since we started, where we had a population of 85,000 with no medical home, we now have educated, screened, navigated, and treated over 16,000 of those women.
Good.
And next year, we're going to double it. And we're building a model, a systemic model that shows communities with help of volunteers, people who are adding philanthropy to what the federally qualified healthcare centers can already do, to make sure this doesn't happen. It just doesn't make sense.
Yeah.
And we're just not applying what we need to apply.
Yeah, no, it's definitely a disturbing number. Like we mentioned to our viewers who are watching right now, Black women, 42% more likely to die from the disease. The foundation also says that Hispanic and Latino women tend to be diagnosed at a younger age with breast cancer and sometimes with a more aggressive form of this disease. So representation definitely is huge. Brenda, how was that process for you? I mean, we do lack a lot of Black and brown doctors. How was that for you as a Black woman seeking help during this process?
I didn't know that we had this organization out there, and I am truly grateful because I think it's a lack of knowledge, and I think the community as a whole, along with these organizations, can come together and educate Black women that we do have these programs out there that can help us. We don't have to sit there and worry about how we're going to pay a bill. One of the things that really helped me was the fact that when I went for my initial visits and through this organization, I had a navigator that reached out to me, and she came and spoke to me about the financial portion of it. I did not have the fact that I had to worry about the cancer alone was a big issue, because when you hear cancer, you think death sentence, right?
Yeah.
But the fact that I didn't have to worry about the financial portion of it was a really, really blessing. And finding out that I had these programs available to me was a true blessing.
Yeah.
And, you know, even now I share with other women that there is help out there. There is help out there. And I thank Nancy and her supporters for all the wonderful things, because, you know, I was taken care of from the day that I took my first visit to Fund Care. Up to this day, I had my surgery, I had my mammogram, I had my ultrasounds, I had my biopsies, and I did not have to pay one penny. So praise God for that.
Wow.
And I'm truly grateful for those that stood there in the path to help me. And I want Black women, women of color, to know that we don't have to suffer. We have that, you know, that those facilities out there that will and is able to help us. And I think poverty has a lot to do with it, because we worry as women. You know, we have family, we have children, we have husbands, wives, and you think about it, we can't afford it. My husband was the only breadwinner. I didn't have insurance through him because he didn't have a full-time job where I would qualify for insurance. So I thank God for Promise Fund of Florida and the wonderful job that they're doing. And because of them, I am a healthy person today.
Yeah, and final thoughts, Nancy, we're almost out of time. I mean, this is great that she was able to fall into your hands and come to her full health. Let's talk about, you know, anyone that's watching right now that's kind of hesitant to ask for that help. What message do you have for them to, you know, not have the financial aspect be a burden for them?
Go to our website, thepromisefundoflorida.org. And also there's a number there that you can call. Help is there for you. And we have created this model. As Brenda said, it's a model, it's a system that could be duplicated anywhere in the country with a little will on the part of community volunteers and people like myself, who I've been through breast cancer too when I was young, but I had the best care and insurance and everything else. I still had a serious disease, but the point is, it is amazing what happens when people can know and believe they have a place to go. People care about them. They want them to do well. These are two totally breast and cervical cancer diseases that can be cured when they're found early. And what a weight off of a woman's mind to know that.
I love that. Health is wealth, and there is help out there. Breast cancer survivor Brenda August, thank you so much. And Nancy Brinker, co-founder of the Promise Fund of Florida, thank you so much for your time here on the Midday Jolt. We appreciate it.